No woman should ever be diagnosed with cervical cancer. Now I get it. You're probably thinking that's a really bold statement to be making. Why should I believe that no woman should ever be diagnosed with cervical cancer? But this optimism is actually shared. So Ian Fraser, who is the co-inventor of the HPV vaccine, says that cervical cancer should be almost entirely preventable, while Cancer Australia has stated that vaccine and screening makes cervical cancer one of the most preventable cancers. So why should you care about cervical cancer? Well, an estimated 912 women will be diagnosed with cervical cancer in 2017, and 254 of these women will actually die from the disease. Now, when we know our vaccination and screening programs make this disease almost entirely preventable, that is just 254 deaths, way too many. So what can you do to help protect yourself against cervical cancer and even lower some of these statistics? Well, all you need to do is take part in the screening programs and make your pap smear appointment today. So let's have a little chat about what cervical cancer actually is. So cervical cancer is the growth of abnormal cells in the lining of the cervix. If these abnormal cells are not detected early, they have the chance to develop into tumours with potential to spread throughout the body. Now, these changes are usually brought about by an infection known as human papillomavirus, or HPV. Now, there are over 100 strains of HPV, but types 16 and 18 have been identified as the ones causing nearly 70 to 80% of cervical cancers. Fortunately, we now have an HPV vaccine, and this is available for free in schools to males and females aged 12 to 13. The vaccine is most effective if delivered before becoming sexually active. Unfortunately, the vaccine cannot prevent against all strains of HPV and is only known to prevent up to 70% of infections. So regardless of the vaccine, regular pap smears are still essential. Now, I previously mentioned that cervical cancer usually starts with abnormal cell growth within the cervix. These are some histological examples of what this abnormal cell growth looks like. It might not mean much to you, but it's going to help me explain why it's important that you go get your screenings. So the first example we have on the left is a normal set of cervical cells. As we move up to the right, we have what's called hyperplasia, and this is where the cells have started to increase in number, and you can see that the little purple spots, which we call the nuclei of the cell, have started to increase in size. As we go further along, we have what's called dysplasia, and this is where we start to get some disorganisation of the cells. And this is where we start getting concerned that we may be seeing some precancerous changes, and this is what we're screening for when we have a look at pap smear. Finally, you can see these cells have become cancerous, and so clearly we want to try and prevent that happening. Dysplasia is what we would consider an abnormal result, and we call this dysplasia cervical intraepithelial neoplasms, or CIN. Now, it's important to note that these changes are precancerous with many treatment options available to ensure that they never progress to cancer. They also vary in degrees, so CIN1 involves mild changes, and we'd want to monitor these moving forward, and most women will see these reverse without any further intervention. CIN2 to 3 are moderate to severe changes, and your doctor may wish to refer to a gynecologist for what we call a colposcopy. Now, this is just so they can have a closer look at the cells and better confirm what's happening and discuss any possible treatments if needed. In the case of severe changes, treatments usually involve only a very simple day procedure, and these include things such as a LETS, cone biopsy, or laser. So once again, what can you do to protect yourself? Well, you can make your pap smear appointment today. Now, I totally understand that maybe you're not going to be quite as smiley as my little girl on the right, and maybe looking a little bit more like this. There is nothing to be concerned about, and it's all cool. I'm going to talk you through it. So step 1 of your pap smear appointment is to call your clinic and make an appointment with your GP. Now, let's not lie about this. We know that the first step is often the hardest, but once we've made it, everything else tends to roll from there. So knowing that you might be feeling a little bit nervous, a bit apprehensive to make that call, I want to give you some really great tools to help you out and make this process a little bit easier. So what I want to do is give you a really great script that you can use when you do make that call, along with some points on what to expect on the end of that phone call. So let's start with the script. So you're going to call your GP, your receptionist will pick up, and I'd like you to say, "Hello, I would like to make a double appointment with a female doctor for a women's health check." So the first thing I'm going to highlight is the fact that in this script I've used the term women's health check. Now you might feel very confident in just ringing and saying I'm trying to book my pap smear, and that's great, but if you're feeling a little bit nervous because that word's making you feel a little icky, using the term women's health check is a slightly easier way to go about it. Our medical receptionists are very well trained professionals and they know how to handle all sorts of inquiries, so they will understand by women's health check you mean a pap smear, and therefore they will handle your inquiry appropriately. Next, I want to highlight the point that I've said female doctor. Now, this is actually not essential. You can have your pap screening done with a male doctor, and they will be exceptionally professional and just as compassionate and caring during this process. However, knowing that most women feel more comfortable with a female doctor, particularly on their first pap smear, that is why I've included in the script. Finally, I've asked you to make a double appointment. Future pap smears should only need a single appointment. However, most doctors will prefer that you make a double appointment for your first pap smear. This is to allow time to be able to explain to you the screening process, help you feel more comfortable, and sometimes the first pap smear can take just slightly longer. So when you make your phone call, be sure to ask for a double appointment. Okay, so you're ready to make that phone call. That script one more time. Hello, I would like to make a double appointment with a female doctor for a woman's health check. Boom, check that off, appointment booked. Step 2, attend your scheduled appointment with your GP. And cue panic. No, there is no need for that. I'm going to talk you through it just as your doctor will. So as I've mentioned, the doctor will likely take a little bit extra time with you on this first appointment. They'll want to ask you a few additional health questions so they have a more complete screening, but also make sure you're comfortable with the procedure. I also want to talk you through what will happen now, so again, you can walk in and feel a lot more comfortable with what's going to happen. Now obviously you're going to have to remove some clothing, so what will most likely happen is the doctor will direct you over to the bed and pull across a privacy curtain so that you can remove your clothes from the waist down and then lie back on the bed provided. There should also be a sheet that the doctor's left there for you, and this is so that you can drape it over your midsection so you don't feel exposed when the doctor then comes to see you again. When you're ready, the doctor will approach you and they'll ask you to bend up your knees ready for the procedure. Now there's a few different techniques that the doctors may use for the pap smear. Sometimes they'll ask you to make 2 fists and place them under your bottom, and this just allows them to have a better angle to access your cervix. Different doctors have different techniques, but they will talk you through what you need to do. When you're in place, what they will then do is use an instrument called a speculum. Now, the speculum is usually plastic, and they'll insert this into your vagina, and the idea is that it will just hold the walls open enough that they can access your cervix. It's important to know that this is not painful, though I won't lie, it's not always the most pleasant. So, just remember that this only lasts a few minutes, so while it might be a little bit uncomfortable, it's only a short period of time, and as I've said, it is not painful. When the speculum is in place, the doctor will take a very quick swab of your cervix, carefully remove the speculum, and then the procedure is done. Now that your appointment's done, the next stage is waiting for your results. Now this should normally take a couple of days, and your doctor or someone from your clinic should give you a call to let you know how things have gone. Now most of the time the results are completely normal, and they'll just ask to make sure that you book in for your pap smear every 2 years. Occasionally there'll be some abnormal results, and in this case the doctor will just ask you to make another appointment so they can discuss what they're going to do moving forward. Majority of the time this will just be low-grade changes, and your doctor may just wish to monitor these a little bit more closely, and all that means is they may ask you to book in for your pap smears a little bit more regularly. Regardless of what the abnormal changes may be, you need to remember that these are precancerous, and the whole purpose of this screening is to catch them before they become cancerous cells that may become problematic. So there is no need to worry, just follow your doctor's instructions. Step 3, schedule a pap smear every 2 years. So now that you know that the appointment is not that bad, the hard part just remains remembering to book in every 2 years. Unfortunately, there's some tools to help you with this. So after your first screening, your details are automatically added to the National Screening Register, and they will send you out a reminder when you are due for your next pap smear. Your GP clinic will likely have their own reminder service because it is super important that you continue to book in every 2 years. Now, you may have heard some rumours about a 5-year test, and this is totally true. From December 1st, 2017, the current pap smear test is being replaced by the more accurate cervical screening test, and this will increase the time between tests from 2 years to 5 years. However, it's really important that you discuss this with your doctor and remain getting tested every 2 years until told otherwise. There are some other changes that come with this test, including the initial screening age increasing from 18 to 25 years. The new test will also better detect persistent HPV infections, along with the abnormal changes that the current pap test finds. The test will be available on the Medicare benefit schedule, and it is anticipated to prevent an additional 140 cervical cancer cases each year. So now I hope that you understand why I say that no woman should ever be diagnosed with cervical cancer. More importantly, I hope that I've inspired you to book in for your pap smear if you haven't done so already. I hope that I've given you the tools to make you feel a little bit more comfortable through this process, and that you'll call your doctor and make that appointment today.